Let's talk to Jamie Jenkins, independent statistician, political commentator, of course, as well. Jamie, very good afternoon to you.
Good afternoon, Mike. How are you doing
Yeah,
over there
not
in
bad
London?
at all. I had a very interesting conversation with one of your compadres yesterday. I don't know if you heard the woman in the Swansea cinema who basically said, we're not doing it. And if you turn up and come and see anything here, or you want to come to a party or whatever, we're not going to ask you for a vaccine pass. She wasn't sure if that was breaking the law or not, which is interesting because I don't know whether it is either.
No, I'm not really sure either, Mike. And I suppose it'll be a good test case. And I think you've been talking this morning about this kind of vaccine passport creep
Yeah,
across the country. My partner went to London for a kind of an NHS conference probably about 4 or 5 weeks ago now,
right.
and she found out a couple of days before that she needed a vaccine passport to go to that venue. So I think whilst they're in place in Scotland and Wales and Northern Ireland are voting for them, there does seem to be this huge creep within England as well. And if we're just looking at the facts and figures on these, Mike, Austria had vaccine passports, cases through the roof. You've got Germany, cases are higher in Germany now than they've ever been,
Yeah.
and they've got vaccine passports. Republic of Ireland had vaccine passports, and they've now brought curfews in and mandatory working from home because ultimately these vaccine passports, Mike, they're not really doing well, when you say what they were meant to do on the tin, I think the main thing for these, Mike, was a couple of things. I think the first one was to try and coerce people into having a vaccine. Well, if we look at the data on vaccines, they've not really moved at all over the last 18 months and stuff. So that's a big problem there, Mike, I think. So
Yeah.
we need to kind of look at the facts and figures.
Yes, no, I think that's absolutely right because the problem with all of this, right? Is there something that he needs or she needs? I mean, I don't mind if you bring them in and have them sit on your lap. It's fine. The thing is that the nonsense, as you pointed out, I think the last time you and I spoke, because your son, I think, had been sent home from school. You said that you had contacted COVID, but you could have gone out if you wanted to, without telling anyone, and shown a vaccine passport to get into a venue, and yet you were live with the virus, and they wouldn't know that, right?
No, indeed, that, Mike. And what's interesting actually with my son is that I think about 13, 14 people in the class all caught COVID, and some of the children didn't, but the ones who didn't, from what I gather, previously had COVID. So one of the things that seems to be missing through a lot of this policy is kind of natural immunity. And the ONS released some interesting statistics yesterday, Mike. So I'll just quickly rattle through some of those because they were looking at the probability of kind of catching COVID. And what they were showing is that if you're kind of vaccinated, if you've had a booster or had 2 doses of the Pfizer vaccine in the last 3 months, you're probably 80% less likely to test positive for COVID than if you've not had a vaccine at all. Okay, so that's a good thing. You can clearly see the effect of kind of the vaccine waning. So it's 80% less likely to test positive than an unvaccinated person for a booster or a recent second dose in the last few months. It's only 50% less likely if you've had the kind of the dose over 6 months ago. So you can see that it's not as effective. But what's more interesting in all of this, Mike, as well, is they also looked at people who've had the infection before versus those who have never had the infection. And the reduction is remarkable there as well, that you're 80% less likely to test positive for COVID if you've had COVID in the past versus somebody who's never had COVID. And we just seem to have forgotten all about natural immunity within the country at the moment. And that's going to play into all the care workers who've been sacked, more likely to have caught it than anybody else because of their front line. NHS staff as well, Mike, we've got about that. And then Boris this week talking about changing the goalposts on who's triple vaccinated if you can have a vaccine pass. Well, I've just coming out the back end of COVID, Mike. I've had 2 vaccines, but I don't see the point of having a booster when I've just caught COVID and got over it.
And yet this morning we see a piece in the Telegraph which is basically saying from the UK Health Security Agency that I've never heard of until today, they're basically saying if you've had COVID as a child, i.e. a 12-year-old to 15-year-old, you should wait 3 months and then get a vaccine. So they're now not only saying that kids should be vaccinated against it, they're saying that kids who have had it should be vaccinated against it. And you're going, why?
Well, it's just a waste of public resources on this, Mike. So the UK Health Agency, basically, it's a rebrand of Public Health England. They decided that Public Health England weren't doing the right job for the pandemic. So I think they just moved the deck chairs around and created a new department.
So that's
Mike.
the name of it now. So it's now called UK, but it's the UK. Because I remember when Matt Hancock did away with with NHS England and said we're going to call it something else. And then they kept calling it NHS England for about the next 3 months.
Yeah, so this is the new name for it. And if you look at it, Mike, in America, they're pushing the vaccines now down to kind of 5-year-olds.
Yeah.
And they're like, it's going to carry on going down. I think, we seem to have forgotten this whole natural immunity that exists. It's quite clear. I think they're pushing to get people to have the vaccine because you want to stop the NHS being overrun. But it's very limited in terms of the impact on children. We know vulnerable children, Mike, and already having the vaccine. But I think that the problem you've got, Mike, is that you keep rolling this vaccine out, taking the resources out. And remember, so there'll be a lot of children, Mike, because we know the cases are rife among children. Very few of them show any symptoms at all. Sometimes it just happens to be if you've tested positive because you was asked to go for a test because somebody else had a few symptoms. How does a parent know if their child has had COVID in the last 3 months, if they've had it, but they showed no symptoms and never tested positive for it? How the hell do they know about that in terms of deciding if they go for a vaccine or not? We should be testing people for antibodies. The ONS does a random survey across the country, Mike, for people with antibodies, and it's way over 90%. The vast majority of people have antibodies in the country, whilst cases are starting to uptick now in the UK, Mike. And they're probably going to go up because Germany are up, Austria are up, France are up, Republic of Ireland up, Belgium, Netherlands, the whole of Europe's going up.
Well, it's that time of year, isn't it? You would expect things to go up in November, wouldn't you?
Exactly. And I think they're probably going to go up now until about January time. But cases isn't the key metric to look at. Let's look at hospitalizations. Now, what the booster vaccine is doing, Mike, for those people who are vulnerable, especially the elderly people, because the booster does reduce the chance of you catching the virus. It doesn't get rid of it completely. We know that people who've got vaccines still will catch the virus. We are seeing cases come down in the elderly. And if you start thinking about how have we managed the flu respiratory viruses over the last kind of 50 to 60 years, since the vaccine's there, Mike, we vaccinate the vulnerable, and then that reduces the pressure. I think the problem we're going to have, Mike, and I think I said this on the show several months back to you, is the NHS cannot cope in a normal year. We're going to basically, because these COVID numbers are all over the news every single day, COVID patients are a fraction of what they were last year. They're half this time last year, despite cases being higher. Deaths are a fraction of what they were this time last year, but cases will go up. Inevitably, there'll be patients in hospital and people will be saying, oh, we need to close down the country because the NHS can't cope. But the NHS couldn't cope, Mike, probably before COVID.
But the NHS is always being sort of threatened with closure and threatened with being overwhelmed, but it's never actually been overwhelmed. I mean, even back in January, when we had, 1,000 cases a day going into hospital, it wasn't overwhelmed then. So if it wasn't overwhelmed then, it's not likely to ever be overwhelmed, I don't think. And the thing that worries me is that they're now sort of actively looking for reasons to say that it might be overwhelmed. I mean, I got a text the other day, and I don't even know how they got my number, from Ipsos Mori, right? And it says this: we recently sent a letter inviting you to register for a swab test kit. Taking part will help monitor infection rates and new variants of the virus. It takes just 5 minutes to register. You can imagine what my response was. I mean, they're basically looking for other variants now that they can say are happening in the world so that they can tell us that they need to clamp down on something again, And it seems to me that that is a ludicrous state of affairs, because we've got another story here this morning where it says the COVID-19 infectious variant of Delta now accounts for 1 in 10 COVID cases in England. Well, so what, would be my response.
No, it's becoming a bit of an industry, all of this testing. I've seen some startup looking at doing or trying to develop a test for a cold. So we can, and it's just going to start creeping in now where companies will say, you've got to show that you haven't got a cold before you can come to the office.
Well, do you know what's even more bizarre in my world this past sort of week or so? One of my kids had a bit of a bad cold, and the school's advice was to go to school. And you're going, sorry, I thought if the kid had something infectious, you were supposed to stay home. Apparently not. They're worried apparently because he might have missed too much of his class. And you go, he didn't go at all last year. What are you doing about that? Oh, nothing. Okay, then. It's mad.
No, it is mad, Mike. I think, as long as we're testing, and there's significant testing, we are one of the biggest testers in Europe, we will continue to find cases. Now, I think that the key metric in all of this is ultimately, Mike, is going to be the number of hospitalizations and deaths. Now, they are significantly lower, but a vaccine passport, if you just go back to that kind of policy, where people who've been double jabbed can still pass it on to somebody else who's double jabbed, and the vaccines will help reduce kind of hospitalizations and deaths. That's just these vaccine passports are absolute nonsense, Mike. An important thing is, whilst we're seeing the waning of the vaccine, it's an interesting statistic on this one, though, Mike. The waning of the vaccine means that we are seeing more cases among kind of vaccinated people, because it kind of, the chances of you catching the virus is starting to creep up with the waning of the vaccine.
Yeah.
But from some of the epidemiologists at the UK Health Agency are saying actually that even if you do catch it, the risk of you going into hospitalizations or deaths hasn't been affected at all
No.
with regards to kind of the vaccine. And so the whole point of the vaccine, Mike, was to reduce all of the things. Nothing has really changed. We knew when we opened the country up, the virus would continue to spread. If we tested every single year for the last 30 years for the flu, we would have get some people saying we should have locked down every single winter for the last 30 years. It's not an area we can do, Mike. We've got to learn to live with it. Like we said in the summer, and things haven't changed from that perspective.
No, exactly right. And as far as more people being tested positive who have been vaccinated, that could also just be a numbers game, couldn't it? Because more people are now vaccinated than before. So people who are getting it are more likely to be vaccinated because there's a lot more vaccinated people than unvaccinated people. So it's a simple numbers game, I would have thought. And the bottom line for me is that if all of these people who keep testing positive are as large as we are being told, then the combination of the numbers being vaccinated, the numbers of people who must have had the disease, it must be practically 100% of the population, mustn't it?
Well, it's going to be getting closer to that, Mike. There'll still be people who are unvaccinated who've never caught the virus, and those are probably the ones that are the highest risk. But remember, there still is a virus that's very deadly for the elderly people. And you only got to look at the vaccination stats, Mike. We've got in the oldest age groups, way over 95% of people have had a vaccine. Some of them would have caught COVID. Sadly, some of people who would have caught COVID and sadly died as well. So ultimately, Mike, I think the only route out of this whole kind of mess, if you want to call it, with regards to COVID, looking likely across different countries as well, is it's going to be everybody catching the virus and then getting over it. What the vaccine has done for many people is that if people have caught the virus, whereas say in the past, just by looking at the statistics, they would have ended up kind of sadly dying from the virus, that's significantly lower. If you look at the moment, we've got about 40,000 cases in the country, Mike, and the average number of deaths per day is around 150. Now, some of those would have sadly died anyway, but some of them, have survived, because if we look at when there was 40,000 cases in the past, we were getting way over 1,000 deaths per day. And I think when we're going into this winter now, as we're starting to head towards it, I don't think there's anything different to what we would have expected. A respiratory virus, which increases in the winter, which would put a little pressure on the health system. The key question is, Mike, what has the health system done to prepare for this winter? Has it done anything different?
Well, nothing. No, I mean, I've been saying this since the beginning of January. I said, what is the NHS going to do to make sure that if and when the next big wave hits, if it ever does, which it doesn't sound like it will, they'll have learned nothing. They'll have done nothing, and it will all be exactly the same as it was last year and the year before that and the year before that, because every single bleeding year we're told the NHS is going to, keel over.
And then the problem you've got as well, Mike, especially with people saying, "Oh, we need to bring in more restrictions," is the reason kind of there's a lot of more pressure, say, on the NHS this year compared to this time last year. It's not specifically down to the COVID problem, because I said the number of patients in hospital is a half of what it was, and the patients that do go in are having milder illnesses on average because of the vaccine effect. What we've got, Mike, is significant numbers of people coming forward because they've missed out on healthcare over the last 18 months, with mental health issues, with heart problems, with strokes. And another thing that's kind of remarkable, it doesn't get talked about a lot, Mike, is that the number of people dying in their private homes. Because we get the figures every single week. You can track where people are dying. And the most recent week, actually, was staggering. There was a 41% above average, the number of deaths just in the most recent week alone of people dying at home. Now, some of those will be people who we may have seen a step change now in life, Mike, where some people choose to perhaps have their last days of life at home rather than go into, say, hospital so they can be around their loved ones. But these age groups of these excess deaths, they are in people in the ages of 30, 40. These aren't people generally towards the end of life. And that is a worrying statistic, Mike. How many people out there have missed out or felt, I don't want to go and phone the GP, I can't get an appointment, and then they just drop in dead? It's remarkable.
Yeah, it really is extraordinary. Good to talk to you, Jamie. Got to run. Thank you very much indeed. Jamie Jenkins, independent statistician, political commentator, of course, formerly with the ONS, Office of National Statistics. But what on earth is going on out there? Why are we finding that somehow vaccine passports are being introduced sort of by stealth in lots of different ways that we didn't know about? And why is it, for example, that so many people are still testing positive and yet they're not troubled, they're not going into hospital? And why, as Jamie says, there's so many people dying in their own homes from other things? What is going on there? This is Talk Radio.